Hey, good morning, friends. How are you all doing? I told you I was going to come back at you a few times this month, since it is Heart Month, with a few little nuggets that may be on your mind as it relates to heart and heart health. Dr. Coop, MD, here on a fantastic Tuesday morning, up in the clouds a little bit. Anyway, so the question came from my DM over the weekend about marijuana and the heart. Yeah, we got more people out here smoking and using various forms of marijuana and its parent compound, THC, CBD, etc., etc. And so many of you may be wondering, what is the effect of that on the heart? Well, let's just go back to this. Point number one, smoke of any kind, if you're smoking it, is very likely harmful and dangerous, not only to your heart, but also your lungs and your vascular system in general. So that's number one. The byproduct of burning a tobacco product along with a paper product is tar, or the residual chemical components in the wrapper, the paper, or the blunt tobacco, whatever it may be. So that's an issue. Okay, so think about that. The risk is there. And so it's not mitigated by the fact that you are taking THC, you're still smoking. Now, there were two large studies that were reported last year late about marijuana and THC and its effect, daily marijuana use and its effect on the heart. One was a very large study. The other was a smaller one, but they were both what we call observational. So basically what they did was just looked at people who self-reported using THC or marijuana products when they were admitted to the hospital. They looked at their risk of developing or a heart attack or some other heart-related problem, i.e. an arrhythmia, meaning the heart beating out of sync, or heart failure, okay? And in both of those studies, quite frankly, the risk of developing a heart attack, heart failure, or having an arrhythmia was higher in those people who reported daily use of marijuana or THC. So not necessarily conclusive because it's not a head-to-head prospective randomized type study. That's number one. One of the studies was really very interesting and good because that study excluded people who were also concomitantly smoking cigarettes or other tobacco products. So they specifically asked, are you just using marijuana or you're using both marijuana and tobacco products? So what they did was just looked at the people who were just using marijuana, THC type products. What was not very clear in either one of those studies was the form of THC that people were using. Were they smoking it? Were they vaping it, i.e. taking in the vapor as it relates to smoking an oil or some other type of byproduct of THC, or were they eating it? Okay, those things were not parsed out. Okay, so bottom line for right now is that I would say overall is that it's very likely inconclusive. All right, in other words, we can't just poke a stake in the ground and say, oh, absolutely, this is this is that. Okay, but what we can say is that there's very likely a very strong association of daily marijuana use with the risk of developing a heart-related problem, heart attack, heart arrhythmia, or heart failure. Okay, so keep that in mind. If you have been diagnosed with one of those, it's very likely that you are at higher risk of developing one of those problems. So just keep that in mind, you all. I hope that was very helpful. I hope you think about these things and look into it and discuss it always with your doctor before you decide to come to any kind of determination as to what your risk is. Very important to sort of address the basic things first, always. Take care. Dr. Coop, MD here, signing out on Tuesday morning. Love you. Not a damn thing you can do about it. Hope you have a fantastic week ahead. Bye.